It's okay, I'm talking to the phone.
Sorry.
Is it going? Do you see me? Okay. Hi, it's Dr. Mueller. I'm just gonna roll a couple Unna boots on this nice patient and just talk a little bit about how we do it so that hopefully you can do it too. Okay, I've just cleaned her leg with betadine, just some betadine. The Unna boot stays on for a week at a time. That's a long time, so we like to sterilize the skin before we apply the Unna boot. So the betadine sits on there for 3 to 5 minutes while you do something else. Get set up, get your stuff ready. Let the iodine dry. The iodine has to be dry to do its thing. The iodine's been on for a while, so now I'm going to get started with the Unna boot. The first thing is to put some goop on the skin. The skin is usually dry. The Unna boot stays on for a week, so you want to do something to keep the skin nice and moist. You can use Vaseline, A&D ointment, lanolin, honey, whatever. It's all the same. It's just trying to keep the skin from getting too dry. So I have this lanolin here, and now I'm going to put it on. You know, I just remember I got one other thing I'm going to grab before I get goopy. 1 second. You can keep filming, Ruth. Okay, all right. Okay, now I'm going to goop up the legs. All right, here we go. Just going to rub this stuff on, get it all over the place, especially over the areas of ulceration, which are usually around the ankles or something. Okay, kind of rub the betadine into it so it's, there you go, that looks nice. Okay, we're going to come over here and do the same thing. And of course, you got to let the betadine dry before you put the goop on, otherwise they don't mix. Once the iodine's dry, it mixes nicely, like you can see here. Okay, she's got tenderness over here where ulcers occur, so I'm going to put a extra goop over there. Okay, so that looks nice. That looks nice. So now I'm going to start rolling the Unna boot. This is a Coflex roll, which is a calamine roll, foam roll, and we're going to usually start at the top and go down. This doesn't hurt. It's not tight or anything. You just roll it kind of snug. It takes a little practice to use the whole roll. Sometimes you go down and then you go back up, but that's okay. So I got this going here. This is bilateral Unna boots, of course. Okay, so she's a little person. I got a little extra roll, so I'm going to go back up. Okay. Okay, good. And now I got the other one. Put this on over here. Okay, all right, same deal. You want to start pretty close to just below the knee. Otherwise you get swelling between the knee and the Unna boot. People don't like it.
It's not swollen, is it?
No, it's not swollen at all. So I'm coming down, and once again, I'll put a little extra roll in the areas where she's tender. Here we go. Okay, around here. And this is pretty easy. You know, this isn't require any skill. Just rolling it like this. And I'm going to roll up like this. Okay, yeah. I'm just about done with that. Okay, good. And now for these rolls, these are the Coban rolls. They're a little tight, so you want to be careful you don't put it too tight on the patient. And you always want to ask the patient, is it too tight? Is it too tight? Because if you put it on too tight, then they're going to take it off an hour after they get home, and that was a big waste of time. So you want to confirm that it's not too tight. I like to use this little stick. It helps me kind of adjust the tension I'm putting on it. I can make one for you if you want. The other guys just roll it with their hands, but it's the same. So I just roll this up, not too tight. Try not to grab the Coban roll because it gets hard to unroll once you put your thumb and imprint in it. Okay. All right, so here we go. And once again, depending on the size of the patient, you may have extra roll or run out of roll. You can just come back down a little bit. Okay. And depending on whether you grab this roll, it may be hard to get it all the way off. Sometimes it gets stuck on there. You might even have to use a pair of scissors. But that came off nicely. And now I'm just going to take a little tape, put that on there so it doesn't unroll. And I'm going to do the same over here now. I'll get this. How's it feel? Okay? Not too tight? Okay.
This is the only thing that bothers me.
This leg, okay.
Yeah, it hurts.
Okay, so. All right, now off we go. Okay. Well, I sure appreciate you letting me film this.
I appreciate you doing it.
Okay, let's see. And the calamine roll is pretty flexible, even if it bunches up, it's all the same. Okay. Now it's important to have everything ready. The nurse already prepared everything, so it was sitting there on the Mayo stand. But once your hands get goopy, that's not the time to realize, oh boy, I forgot the tape, or oh boy, I forgot this or that, because then you got to get new gloves and everything. So have everything ready. And you'll notice how I'm standing or sitting here. I'm kind of on my knees. It's not the most, okay, so this one's a little stuck, so I'm gonna, sometimes it's like that. And like I said, you can always cut it too. Okay, so that's pretty stuck. It's funny how one roll is fine, and so I'm gonna go get a pair of scissors. Oh, there. Okay, and of course, that kind of slows you down a little bit. What can you do? Okay. Don't ask me why one's like that and one's not. Okay, what was I saying? Oh, try to have everything ready. Like the scissors, I didn't have them ready. So fortunately, Ruth was right there. Okay. And then the final is just these little stockings. Does that feel okay? Not too tight?
No.
Okay, good. All right.
It feels heavier than it does when I came in.
Okay, okay. We'll put these guys up here. And then I got this one. And then the patients always follow up in a week. So if you put on the Unna boot, you don't have to ask us when's follow-up because it's always a week. You can just go ahead and make the appointment. Okay, and then, if you don't like how something looks, let us know. Okay, good. I used the extra big chuck because it always makes a huge mess.
Oh, you're pretty neat.
We'll slowly kind of clean this up. Okay. All right, so that will conclude this bilateral Unna boots. It took about 10 minutes. It wasn't too bad. It's a little labor intensive, but I think anyone can do it. Thanks for watching.